Throughout the extensive multi-decade span of my medical career, I have dedicated a significant and deeply passionate portion of my clinical practice to a subject that is far too often relegated to the shadows of whispered conversations and societal taboos: the intimate wellness of the mature woman. I have had the profound honor of guiding thousands of female patients, women who are leaders, creators, mothers, and pioneers, through the therapeutic, restorative, and deeply empowering practice of autosexual activity, or what is colloquially known as manual self-pleasure. I want to state clearly and unequivocally from the outset, this work is among the most fulfilling and vital dimensions of my profession. In the often sterile, hurried environment of modern clinics, many women arrive with a heavy burden of silence. They present with a complex array of challenges regarding their sexual function. Challenges that are frequently intertwined with their self-esteem, their long-term relationships, and their fundamental sense of physical vitality. In a striking number of these clinical cases, the prescription is not a pharmaceutical pill or a surgical intervention, but rather a fundamental psychological and physical shift in how they relate to their own bodies. Modifying the approach to self-stimulation is frequently the most crucial component of the therapeutic solution for longevity and liberation. If you are a woman over the age of 60, 70, or beyond, and you have felt as though the world, and perhaps even the medical community, has stopped speaking to you about your desires, this guide is your sanctuary. We are here to talk about greater pleasure, deeper satisfaction, and the achievement of consistent, revitalizing orgasms as a birthright. The philosophy of maturity: why things change. Before we engage with the physical body, we must address the architectural framework of the mind. In our youth, sexual energy is often driven by a biological imperative, a frantic, goal-oriented energy. But the second spring of a woman's life, particularly in the postmenopausal years, offers a different, more refined kind of power. It is a period of true liberation. Many women worry that age-related physiological changes, increased vaginal dryness, thinned tissues, or a slower neurological warm-up time signify an expired system. From a clinical perspective, this is a dangerous fallacy. These changes do not signify the end of your capacity for joy. They simply indicate that your body now requires a more nuanced, sophisticated approach. It requires a different input to achieve the output you desire. Consider this an opportunity to learn a new, more elegant language with your physical self. You possess the foundational knowledge. We are now going to add the finer details, the clinical secrets, and the subtle shifts in rhythm that turn a pleasant moment into an unforgettable experience. Phase 1. The clinical foundation of preparation. Pleasure is a physiological event that begins long before the first physical touch occurs. To ensure that your body is receptive rather than reactive, we must establish a foundation of safety and comfort. Hygiene and skin integrity. This is not merely about being fastidious, it is about protecting the biological integrity of your tissues. As we age, the decrease in systemic estrogen leads to a thinner vaginal epithelium and a change in the pH of the vulvar skin. The hands. Wash your hands meticulously with warm water and a fragrance-free, pH-balanced soap. Scrub thoroughly beneath the nails. Even a tiny, jagged edge can cause significant inflammation in the delicate genital region. Jewelry. Remove all rings or bracelets. Metal edges are common culprits for accidental abrasions. By removing these, you create a safe clinical zone where your body can fully relax without the subconscious fear of injury. The chemistry of glide, advanced lubrication. Post-menopause, vulvovaginal atrophy is a common clinical reality. The vaginal walls become less elastic, and natural lubrication decreases significantly. The solution is never to push through the dryness. Water-based lubricants. Look for formulations that are osmolality balanced to match the natural environment of the vagina. Avoid those containing glycerin or parabens, which can sting thinned tissues. Silicone-based formulations. These offer incredible longevity. Because silicone molecules are too large to be absorbed into the skin and do not evaporate, they provide a consistent glide that is perfect for longer, more exploratory sessions. The saliva warning. From a strictly clinical perspective, I strongly discourage the use of saliva. It contains digestive enzymes that irritate delicate tissue, it evaporates too quickly, and it introduces oral bacteria into the urogenital tract, a primary cause of UTIs in mature women. Neurological priming, the mind-body mindset. Pleasure is a function of the parasympathetic nervous system, the rest and digest state. If your mind is preoccupied, your pelvic floor muscles will reflexively constrict. Diaphragmatic breathing. Spend 3 to 5 minutes practicing deep, belly breathing. With every exhalation, consciously visualize the deep musculature of your pelvic bowl softening and widening. Sensory signaling. Use a small amount of warmed oil to massage your abdomen in a slow, clockwise direction. This tells your nervous system, I am safe, I am being cared for. Stage 1. Preliminary stimulation, the fuel. The most frequent clinical error I see is rushing to the genitals. In your youth, you might have gone straight for the clitoris. In your 60s, that approach often leads to sensory overload or numbness. Vasocongestion. The process of blood filling the labia and clitoral bulbs takes significantly longer now. The technique: begin entirely away from the genitals. Use the flats of your hands to stroke your outer thighs, your hips, and your lower belly. The purpose: this awakens the cutaneous skin nerve endings and begins the slow, steady migration of blood flow toward the pelvic region. The tease: use a piece of soft fabric, like silk, as a barrier. Apply a pulsing, rhythmic pressure with your palm against your vulva. This teasing buildup engorges the labia, making them more receptive to direct touch later. Stage 2. Clitoral awakening, the epicenter. The clitoris contains over 8,000 nerve endings. However, post-menopause, direct stimulation to the glands, the tip, can feel overly intense or electric if the tissues aren't fully prepared. The technique: focus on the clitoral hood. Place your fingertips slightly above or to the side of the clitoris. Perform minute, circular motions. Think smaller than the size of a dime. The clock. Method: imagine a clock face on your vulva. Touch lightly at 12, 3, 6, and 9 o'clock. This stimulates different nerve bundles and prevents sensory numbing from repetitive motion. Biofeedback. Pay close attention to your physiological markers. Is your breathing catching? Is your back arching? These are green lights. If it feels sharp, broaden your touch by using the flat pad of your finger rather than the tip. Stage 3. Intravaginal exploration, the architecture of fullness. For those who enjoy internal stimulation, the goal is not thrusting, but rather exploration of the internal landscape. The entry ritual: after applying a generous amount of lubricant, rest your finger at the vaginal opening. Wait for the melting sensation where your muscles relax and invite you in. The come hither motion: insert one finger and gently curl it toward your belly button. You are looking for the anterior front wall of the vagina. The nuance. The vaginal canal is a complex architecture of sensitive zones. Use your finger's ability to bend at the knuckles to find the specific angles that create a sense of internal fullness. This pressure triggers the pelvic and hypogastric nerves, creating a deeper, more resonant sensation. Stage 4. The G-spot blend, the symphony. The G-spot is more accurately described as the urethrovaginal sponge. When a woman is highly aroused, this tissue becomes engorged and textured. The integration: this is where we combine the external and internal domains. While one finger maintains a steady internal tapping motion against that textured anterior wall, use your other hand to continue the rhythmic, circular motions on the clitoral hood. The synthesis: for many women over 60, this dual input is the magic key to unlocking the deep orgasm. It creates a blended sensation that resonates through the entire pelvic floor. It is a symphony of sensation rather than a solo performance. Stage 5. The lighthouse principle, the final threshold. This is the most critical clinical secret I can share. As women approach the precipice of climax, there is a natural tendency to change the rhythm, to move faster or harder. To the mature nervous system, this sudden shift is an interruption. The logic: your brain requires unwavering consistency to cross the threshold. If you change the stimulus at the last second, The wave often breaks before it reaches the shore. The action. Once you discover the specific rhythm that makes your body say yes, you must become a lighthouse. A lighthouse does not flicker or speed up, it stays steady and unwavering. The threshold. Maintain your pressure, your speed, and your exact location. Stay the course. Use your breath to ride the sensation. This steady approach is why many women find their orgasms in their 60s to be far more profound and satisfying than those in their youth. Phase 3. The Sacred Afterglow Resolution. Your journey does not conclude at the moment of release. What follows is the resolution phase, or the afterglow. Immediately following climax, your body is flooded with oxytocin, the bonding hormone, and prolactin. This neurochemical cocktail lowers blood pressure and soothes the nervous system. The integration. Lie still for at least 5 to 10 minutes. Place one hand on your heart and one on your abdomen. Feel the thrum of your circulation as it returns to its baseline. Self-gratitude. This is the moment you solidify the connection with your body. You are reminding yourself that you are a sensory, vital being, regardless of what a calendar says. Conclusion. A lifelong gift. I often hear women say, "I thought that part of my life was a closed book." I am here as a medical professional to tell you that your capacity for pleasure is a lifelong physiological gift. The techniques we have discussed today, preliminary priming, clitoral awakening, internal exploration, blended stimulation, and the lighthouse principle, are more than just moves. They are a clinical map back to your own vitality. Intimate wellness improves sleep, boosts the immune system, and fosters a sense of psychological resilience. You are not acting like a teenager, you are acting like a woman who deeply understands her worth. If this guide has sparked a realization, I encourage you to share your thoughts. We are building a community where the mature woman's experience is celebrated. Your journey of rediscovery starts exactly where you are, right now. Remember, your body's history is not behind you. It is still yours. It is still alive.